Good morning. This is Dr. Mark Cooper again. And again, I'm a psychologist working in the field of chronic pain management. And I've been doing this for 30 years. And I've been developing some non-pharmacological strategies for pain and specifically to help patients or individuals learn how to treat themselves so they won't be reliant upon only on narcotic medications or having to go to a physician every time they have an ache and pain. And today specifically I want to talk to you about a strategy that helps with migraine headaches, muscle tension headaches, cricks in the neck, and other myofascial pain problems that you may have, like pain in the shoulder here, or right in this area here, or behind your back in the levator scapular muscle. And the device I want to talk about as a strategy, it came from really the field of acupuncture. And this is the device. It's called an Acupuncture XL2 device. And what it does, it can shoot an electrical signal out that can disrupt the muscle tension in the person's in the muscle that's causing the pain. So I want to direct you to an individual that worked in this field for many years. Travell's and Simon's work, and this is called the Myofascial Pain and Dysfunction Trigger Point Manual. And in this work, he discovered that there were certain trigger points that would refer pain. Like you can have a trigger point in the upper trapezius muscle here, and that's very frequently is the one that causes headaches. In fact, about 75% of the time, a person's headache that goes over the eye right here is caused by this muscle right here in the upper trapezius. And this is a picture of it. Right there. So you can see that. Up here, you'll notice that the trigger points that are in the upper trapezius right here refer pain to this area over the ear and into the eye. So a lot of people's headaches that they're hurting here, the real problem is that there's a trigger point in the upper trapezius muscle. Sometimes though, it's the SCM muscle, which is the muscle in your neck, right? This muscle right here. It's right here too. And that refers pain into the above the eye and also in what we call the trigeminal area, which is underneath the eye as well. And sometimes the headache is caused by the occipital muscles, which are in the back of the neck, really high up, right at the base of the spine of the head. And these, when you get trigger points in these, they refer pain across the neck. Excuse me, not across the neck, but across the side of the head and kind of into the eye too. Unfortunately, one particular patient might not just have trigger points in this area, but may have trigger points in all these areas. So it makes it a little bit more difficult to treat because they got so many different muscle trigger points. Now, if it's in the neck, a lot of times it's, or you got a stiff neck, or you got a crick in the neck, so to speak, and you slept wrong. A lot of times the trigger points are in this levator scapular muscle through here. Now, the reason why these trigger points develop in the first place typically is because there's a increase in lactic acid that creates the muscles, and the muscles themselves tighten up to protect themselves, and they overlap. The fibers overlap, and then they start developing these trigger points which is lactic acid. And then, but when you do biopsy of those trigger points, we don't really find anything. So what we found is if we could do trigger point injections, needles into there, they can break those trigger points up, and then if you stretch that muscle, then you can get quite a bit of relief. But the problem is insurance will pay for trigger point injections maybe once every 3 months, and frequently that's really not enough to really benefit people and get rid of their pain problem. You need to do something more on a regular basis. Sometimes physical therapy helps, stretching techniques, myofascial pain stretching techniques works, massage therapy works to help this. But this device can be quite effective at breaking up those trigger points really quickly, but it's a little bit painful when you do it. It almost feels like a needle going into the area. But so the way you do this is that you place this this kind of little nipple, and you just compress it, and you can hear that high-pitched sound. Then you push this button, and that shoots the electric signal out. We're going to do that on some different muscle groups here. And what I found out in my practice is that you need to start at the muscle insertion site and then follow that whole band up to get all the trigger points in this. With this device, the advantage of this device is you can probably do 100 trigger points. But with trigger point injections, you can probably do 6 or 8. So you're not able to do as many. But this is a device you can use independently. And so this is the introduction to what we're going to do, but I'm going to show you specifically how to use this with a person here in a minute. And that will be the next follow-up video. Thank you.